very much. I'm a rock star. You can tell I'm a rock star because the logo they created matches my outfit. So I'm definitely a rock star. I really want to thank all the previous speakers, Monica, Elizabeth, Ben, Kate, as well as everyone today, because you really helped us think through what needs to be done to help women access the system. Now, I'm old enough I can say, perhaps the system is the problem, and that's what I'd like to talk about a little bit more, because I didn't advance this. Is it advancing automatically? Okay. Now I'll advance it. What I want to talk about, this is a meeting of mothers. We ask mothers to be here because we want your input. I've had the experience, Kathleen, are you here somewhere? There you are. We did a study in Wake County, and we asked women, these were women predominantly WIC, predominantly African American, and we said, you know, is there a problem with these 4 visits you have to do in the first week postpartum? And they said no. What the? They said, well, we need this help and we need that help and we need this to do it. But no, the 4 visits are not a problem. And I'd like us to think a minute here, who's in control? Who should be in control? And think about the importance of you. Now, this picture may not show breastfeeding to your delight, but I want you to all know, Diane Aspel in the back tells us all the time, the baby, every baby, intends to breastfeed. So there's no question about it. And whether you identify with any of these symbols or any of these additional symbols, let's take the discussion to you. You, the person who should be cared for, not you who has to run around accessing everything that's out there. And who should decide what's best for you and your child. When it comes to breastfeeding, and again, I'm going to be talking about exclusive breastfeeding as our goal, because that's what's optimal for mother and child health. It should be, first of all, your decision should be enabled by accurate information, yes? Mm-hmm. And if you make that choice, your decision should be not only respected, but supported. Yes. Your decision, especially, of course, we're talking about the decision to exclusively breastfeed, is far too often dictated and influenced by others. Kimberly Seals-Allers gave a talk at the last meeting, at the Breastfeeding and Feminism meeting, and she told this story about her interaction with the health system. She took her little boy who was wheezing to the doctor, and the doctor said, your boy has asthma, he's going to have asthma for the rest of your life. And Kimberly said, no, he's not. And the doctor said, excuse me, ma'am, but your child has asthma, he's going to have asthma for the rest of your life. And Kimberly said, no, doctor, he's not. And so you can imagine how well the rest of that appointment went. And Kimberly went home, and she vacuumed everything, she got the rugs off the floor, she changed all the linen, she washed everything, and guess what? The baby did not have asthma. So there can be a disconnect between the best well-meaning care coming down on you and your children versus what you know and can do yourself. Oh, let's see. So the next thought is, when we look at a community, because you do not live in isolation, there's all these factors that you are being told to access. You get home from the hospital, you have to go shopping because the husband hasn't gone shopping, right? Or the partner. You have to go to the health system. You have to figure out how the other kids are doing in school. You. And the issue is, who's caring for you? Mm-hmm. I just have to tell you, this is the cover of a new book, Paige, raise your hand, that we just put out from one of the previous BFI Steak conferences. So I can't claim credit for this little TED Talk picture, but if you are interested in the volume on advancing breastfeeding, it's from Claris Press, little paid political announcement. And again, in this picture, what we have to think about is how are these entities caring for you in that time period, in the 4th trimester. The issue at hand for breastfeeding is that we know there's a rapid drop-off. Is there a pointer here? Okay. We know there's a rapid drop-off both in breastfeeding, but the most disturbing thing is exclusive breastfeeding, which we know has the best impact on both maternal and child health, just dies in the first week of life. It takes a 25% nosedive in the first week. What's going on? What isn't going on? You can't say, Mom, you're doing it wrong. Oh, I just had the experience of meeting a mom of a 3-year-old socially, And we talk about what you're doing. I say I work in breastfeeding. And she said, oh, I really, really, really wanted to breastfeed my child, but I failed in my attempt. And I said, no, you didn't fail. The community, your society, your doctors, your nurses, your friends, they failed you. And here she is with 3 years out. She began crying. This is huge. We are failing women. And by we, I mean the entire community, not just the health system. So remember that there's that early drop-off, but also we all in this room know that optimal breastfeeding is 6 months of exclusive breastfeeding, right? Oops, my last arrow didn't come up. It goes down to 25%, and I think that's optimistic. This is 2012 US data, by the way. I don't think we really are still having 25% exclusively breastfeeding. I mean, they might be pumping away, but the real breastfeeding that is best for the mother and child with the skin-to-skin contact, the brain waves adjusting to the breastfeeding, we don't support that in our country, frankly, at all. So what are our emergent issues? Well, why this rapid drop-off in the first 10 days? I'm sure we all know the answer. Not only is the physiology no longer natural and normal, but you have all those factors we were talking about, the social inputs of medical, and medical, let's not forget, is heavily influenced by medical legal pressure. When somebody was talking about having the doctors interact with the community workers, oh my gosh, what if the doctor says something about a home and something goes wrong and they get sued? No doctor's going to go there today. It's a real problem. Insurance coverage. We are not enabling women to succeed in breastfeeding. Health sector demands get in the way of the mother and child being together 24/7. Commercial sector demands, oh my goodness, how many ads that bottle of formula that's coming to your house every day. Social demands, mother-in-laws, fathers. Studies we did in the 1970s said the most important people for breastfeeding are peer women and partners. Then for years we talked about doctors being so important. Suddenly now new research is showing, guess what? Guess who's important? Peer women and partners. What we really need is systems, social change to meet your demands. So let's talk about this city community 10 steps. What this is a framework that we've come up with that outlines areas that they need to change to enable to care for the mother who wishes to breastfeed. The first is elected officials really should have a written policy routinely disseminated. Oh, I should say we're actually doing this for those who are local. We're doing this in Chapel Hill and Carborough, and we have the mayors have signed on. Hopefully the new mayor will too. That the city as a whole provides a welcoming environment. Why not have a sign at the entrance to the city that says breastfeeding families welcome here? And you know, this attracts young, productive workforce, which is what every city wants to attract. Optimal breastfeeding is supported by health leadership. Like, is that a no-brainer? But it's not happening. Number 4, all pregnant are informed from many sectors about the benefits of breastfeeding. And this is a very complex one, but not just the health sector is saying it. However, we can't leave out the health sector. Healthcare provision is breastfeeding friendly. The hospitals are baby friendly, etc. And non-health system provision is out there in the community. WIC has come a long way since 1990 in supporting breastfeeding. Yay, WIC. And it could come a little further. So let's keep it going in that direction. Today, WIC still accepts a big kickback from formula companies for the formula it buys, and it depends on that for its programming. So they are not free of commercial influence. Step 7 is that businesses, faith-based, and social organizations advertise that breastfeeding women are welcomed here. We actually have one place, at least the Oasis in Carmel Mall here in town, and has a big sign out front, free cup of tea for breastfeeding women. The code of marketing, which is another lecture in of itself, but no advertising directly to the public of not breastfeeding. You know, in the United States, we have the U.S. business case. Our Chamber of Commerce is willing to promulgate that business case to all the businesses in town. And last but not least, let's think about our educational system. So just to conclude, since my time is up, what are our next steps? I think we have to stop saying that it's up to moms to make things work. We have to stop saying, honestly, that we can pay people off, where's Kate? And that that's going to make a difference, because we've done those studies, and it really hasn't worked for bringing people in prenatally or postnatally. We've got to be able to combine the visits. Don't demand a whole bunch of different visits when they could be combined. We have to have home visits like other civilized countries have, let alone paid maternity leave. That's another clapper. Can all sectors, I would like us to study to see, can all sectors coordinate in this manner? It's looking like it can in our pilot. We need to test it other places. And can we build a model for both of these, the healthcare system and the community, that can be replicated around the world, that truly cares for the mother rather than demanding that she access care? Thank you very much.